Welcome to the New Books Network.
Hello and welcome to Madison's Notes, the official podcast of the James Madison Program in American Ideals and Institutions. And this week we will be beginning a two-part series diving into the text In COVID's Wake, How Our Politics Failed Us, which is written by Professors Stephen Macedo and Francis Lee of Princeton University. Macedo and Lee offer the first comprehensive and candid political assessment of how our institutions fared during the COVID-19 pandemic. They describe how, influenced by Wuhan's lockdown, governments departed from their existing pandemic plans. They present this analysis so that in the next crisis, we don't forget the deepest values of liberal democracy, tolerance and open-mindedness, respect for evidence and its limits, and a willingness to entertain uncertainty, with a commitment to telling the whole truth. For part one, we will be speaking with Professor Francis Lee, who is Professor of Politics and Public Affairs at Princeton University. We lay the framework for their text and explore the observations made about the COVID-19 response. We look at the polarizing effects of an election year laid over the dynamics of policy response and the notable events that took our society through the first year of the pandemic. I ask her the importance of raising these questions and notations despite the contentious nature of the subject, and we look at how political polarization impacts our capacity to adapt our practices to more successfully execute a crisis response in the future. As you listen to this episode, keep in mind that you will be able to find more in-depth coverage of all of the topics discussed in the text itself. Francis, welcome to Madison's Notes. Really looking forward to this conversation.
Thank you for having me on, Laura.
Of course. Well, you and Professor Macedo here at Princeton University have a book coming out. It's available March 11th, 2025, titled In COVID's Wake, How Our Politics Failed Us. And just to start off, what was the context in which you both came to each other and realized that this was the book you wanted to write?
Well, it's kind of an evolution. Steve was working on a book where COVID would just be a part of it. The book was going to be about the blind spots in liberal academia, the ways in which progressives are failing to take seriously the complexity of issues on which they're opining, and that they need to engage better with the reasonable criticisms on the other side. And so COVID was one of the issues, but immigration was another, and abortion was the third. So it was a larger project about the state of our discourse. But he started with COVID first, and he and I were having conversations, and he realized that that topic was really huge, and that it's hard to do justice to it in the context of a book about other topics as well. He and I organized a conference together where, if you look in the preface to the book or the acknowledgments to the book, we thank the people who came. It was a diverse group where we talked about the issues in this space and some of the new research. And after that, Steve asked me if I wanted to collaborate with him on the book. And I'm an empirical political scientist. He's a political theorist. And so, given that the COVID response involves both questions about policy and what happened and sort of policy evaluation, as well as a whole range of ethical and moral issues, that it seemed well suited to a collaboration of scholars with our different backgrounds. I was a little hesitant to join on because I had other work I needed to do, and this is also it's a risky area to publish in. And so I hesitated at first, but then I said, yes, I do want to work on this with you. So then that's how we got going. But by that point, he had already written a good bit, and I had given him feedback on the drafts, even when we weren't officially collaborating. So it was organic. It grew over time, but we really enjoyed working together. I certainly enjoyed working with Steve.
Say a little bit more about the riskiness of publishing on this. And you do a deep dive into the book as far as what the narrative of the pandemic is and specifically how politically polarizing it's been. But what was the outweighing factors of benefit you saw in taking on this risk of doing a deep dive evaluation of the pandemic?
Well, in terms of risk, I mean, the moral outrage with which skeptics around the COVID response were greeted certainly would make one hesitate to venture into this space. That reasonable questions such as those raised by Jay Bhattacharya and his collaborators are in spring 2020 about how far the virus had spread, and his efforts to do a seroprevalence study, which resulted in that study from Santa Clara. That it was there was just a firestorm of controversy around what was a reasonable scientific question, one that had been pursued in the presence of previous novel pathogens. So you could see from what happened to others in this space that there were risks involved. And then anytime you opened up a comment section from an article in a newspaper about the COVID response, you would see, like at the Washington Post, for example, you would see commenters wishing death on people who were not obeying the rules, the COVID rules. There was a deep divide in society around these issues. Moralized antagonism is the term we used for it in the book. So we were cognizant of this as we undertook the topic. But why did we do it? I have to say I felt compelled to do it. The topics are so important, and they were just not being engaged adequately in the academy among scholars. Any field, public policy, American politics, in law schools, nowhere where was the many questions raised about the pandemic response being investigated, re-examined, just as that we have never had a COVID commission at the national level to investigate the pandemic response. We haven't seen it on a smaller scale in universities and in the wide array of disciplines that are affected. Or where questions are raised that are pertinent to those disciplinary enterprises. So we felt we needed to do it. I certainly felt I needed to do it. So I figure, well, what's tenure for?
It's a brave thing. And also, before we get into the meat of the book, as far as postmortems go on pandemics and large natural disasters, these sorts of things, has the post-COVID response been different from the responses that the United States government and we have taken for other pandemics and other natural disasters? Has it sort of maintained its uniqueness in even getting immunity within the public discourse space after its, quote, completion?
Well, there was a lot of scrutiny after 9/11. Did we take warnings seriously enough? Was our security adequate? What were the security failings? How should we reform our agencies so that this doesn't happen again? There were hearings into the response to Katrina. So, yes, these big crises have given rise to serious and bipartisan investigations that we just haven't seen around COVID. Now, a prior pandemic, we haven't had a pandemic response like what happened in COVID before. The pathogen, the SARS-CoV-2, was more lethal than those in 1957, the flu pandemics of 1957 and 1968. So they're not comparable. You really have to go back to 1918, 1919 to look at, to find something similar to COVID, though, of course, that pathogen was more lethal than SARS-CoV-2. But at that stage, there wasn't what you'd consider to be a national COVID response or national pandemic response. Decisions about how to react to the spreading pathogen were made locally. So that was a matter for local officials, not even statewide, not even for governors. The question around whether there'd be a national inquiry was far less pressing, in that national decision makers really weren't involved. I think they didn't believe it was capable for them. They were capable of doing all that much to stop it.
I'd love to hear a little bit more about the polarization and political splitting, but how did the political polarization and the moralization of responses hinder our capacity to reflect and respond on how to better manage crises like these in the future?
Well, COVID struck in an election year, and we had an incumbent president running for re-election, an incumbent president who was highly controversial, absolutely detested by the party opposition, long before all before the pandemic struck. And so the pandemic was interpreted immediately through those lenses. And so as the virus was spreading in the US in spring 2020, it was very easy to politicize it for Democrats to say, well, it's the president's fault that this is happening. The president's response didn't inspire confidence among Democrats or even among independents for that matter, in that there was a seat of the pants quality to a lot of those press conferences that the president was doing in the early going of the pandemic. So it just became political fodder. And so Democrats coalesced around a narrative that the United States had a uniquely bad COVID response because of its uniquely bad president. And so you get that, widening polarization around the issue going forward from there. You didn't have the similar degree of polarization in other countries around the pandemic as we saw here in the U.S. But I do have some questions about how important that polarization was to the policies that we chose. I mean, after all, the U.S. followed policies that were quite similar to other countries around the world. That it's not easy for me to point to distinctive qualities about the U.S. response. I mean, federalism kicks in and becomes very relevant in the summer of 2020, but in the spring of 2020, the U.S. locked down like almost every other place. But then what you began to see over the course of the summer of 2020 and for the balance of the pandemic were different policies being pursued in different states in ways that strongly correlate with the partisanship of the jurisdiction.
For our listeners, because this is a two-part episode, speaking with you and Professor Macedo later next week, can you give us a little bit of an overview of how you and Professor Macedo go over your analysis of what happened in COVID and what the main driving points are that you hope readers will walk away with?
Well, the book begins by examining what was thought about how to handle a pandemic before COVID. And so we looked at the state of the literature among experts before 2020 and examined the controversies in the field, that it was an unsettled science, that there was not a consensus about what to do in the context of a pandemic or whether non-pharmaceutical interventions, meaning all the various measures that were taken to reduce human contact in society, whether those would be effective in slowing a pandemic or in reducing overall mortality from a pandemic. That was a matter of debate. And in fact, you see a lot of skepticism about the effectiveness of these measures. The World Health Organization in November of 2019 published a review of what the literature had to say about each of these measures that one might take in the context of a pandemic. And in each case, they say that the evidence is poor. There's a lot of uncertainty. They specifically designate some measures as not recommended under any circumstances. Among those were border closure, contact tracing, and quarantine of exposed individuals. None of those measures were not recommended under any circumstances in the context of a respiratory pandemic. And of course, there's tremendous irony in that all those measures were soon implemented merely months after the report was published in the context of the COVID pandemic. And we look at other reports and other pre-pandemic plans that are quite frank about the fact that we don't know whether these measures work and that politicians would have incentives to use them in order to abate fear and to make the public think that they are in control. And so sort of warning that experts need to be honest with elected officials about the uncertainty around these measures, because they would be under a lot of pressure from the public to show that that crisis, they have the crisis in hand.
Yeah, some of the messaging that I distinctly remember from this time period was that the responses were the science, and it was following the science. What did following the science mean before COVID, and how does that differentiate from the way it was then implemented during the COVID crisis?
I mean, to follow the science before COVID is to acknowledge the poor state of the evidence around these measures and to be clear and honest with politicians about what was known and not known. I mean, it's unsatisfying, it's frustrating, but the world presents us with problems to which there are not always easy answers. a pandemic may be a little bit more like a hurricane than like something we can control. So, but at any rate, the science before COVID was clear about the uncertainties in this space, and yet they went out the window during COVID. There were politicians and spokespersons in charge of the response would go before the cameras and say that we were following the science, as if the science provided a clear to-do list when it did not.
You and Professor Macedo make a hinge on when the World Health Organization sent a delegation to China in January of 2020 that informed a lot of their the background of what they were presenting for everyone else to follow. How did that visit steer the rest of the conversation for the world's responses in regards to COVID? And what's the evaluation or analysis of its validity?
So the lockdown that was imposed in Hubei province in China was unprecedented in its scale. We'd never seen restrictions on society at that level on this large population. The World Health Organization sponsored a delegation to come and to review what China was doing to control the pandemic. And there were a couple of American officials on that from NIH and CDC, and they participated in the deliberations around the report. The report that was published fulsomely praised China. As we put it in the book, it almost reads like an award citation. The number of cases in Wuhan began to come down. The temporary hospitals that had been constructed to deal with the pressure on the healthcare system were taken down. And so then in that context, that style of response was recommended without exception to the whole world, without acknowledging that there are many countries where people are reliant on informal economies, where if you don't work, you don't eat, that there's no way of taking care of people, via stimulus checks or whatever, unemployment systems. It was just blanket, and it was quite strange because we knew from prior pandemics that they come in waves. So how did we know how much of the decline in cases in Wuhan were a result of the lockdown, and how much were a result of just the fact that that's how we experience pandemics, and how they had previously manifested themselves in human societies? But that skepticism was just not applied. Not only did you not get that kind of skepticism among the scientists on the delegation who were crafting the report, you didn't get it from journalists who were responding to it. Now there was some critical coverage around whether the scientists on this delegation had gotten a complete view. After all, this is an authoritarian country, and they were very carefully managed. That the foreign delegates were kept on a separate bus away from the Chinese nationals, and monitored the whole time. So, question is, so there were some questions raised in some of the reporting about that delegation, about whether the picture that the report obtained could be complete, given how managed the group was. But in terms of the claims about the lockdown working, there was a lack of skepticism there. Now, Steve and I trace how there was, in the earliest going in March of 2020, there were voices who were still, you might say, holding on to the collected wisdom in the field before the pandemic and before that WHO report, and pointed to how amazed they were at the scale of the Chinese response, that they had never considered a response like that. So it's very interesting, that could never have imagined it was a reaction that experts who work in this space had to the Wuhan lockdown. And then we even quote Anthony Fauci saying, we don't, these shutdowns don't usually work. Of course, they'd only ever been done on a much smaller scale around things like Ebola. Never on millions of people quarantined on the scale that we saw in Wuhan. But at any rate, there was some doubt. But then after the lockdowns were imposed in the U.S., it's like that just dried up. There just was no longer debate in mainstream discourse around the strategy. It comes back, of course, with the Great Barrington Declaration, which recommended an alternative approach, and instead of trying to lock down all of society, and instead trying to protect those at most risk from the disease. But that was October 2020. So you had a long stretch of time where there was just very little questioning in the mainstream discourse around the strategy that was being pursued all around the U.S. You start to see divergence in reopening decisions across the U.S. So Georgia being first, and then Republican states reopening faster than Democratic states. That the typical Republican state maintained the lockdown, the stay-at-home order for about a month, and the typical Democratic state for just over 2 months. So you already began to see those differences. Those differences unfolded in the context of a discourse, at least if you were engaging with the New York Times, the Washington Post, our major news magazines, the cable news networks, a discourse that didn't acknowledge questions about whether these measures worked. Those questions were not engaged sufficiently. It became a matter of, well, what do you prioritize more, the lives or the economy, as if it was that simple.
Yeah, I would love to hear too a little bit more about how the responses specifically benefited those who didn't have as much to lose, in that it was mostly white collar jobs that were able to go online, and how the policies conveniently centered around those who, couldn't work for a month or two and get by just fine because they have enough savings. But we both know that's not the majority of America. So how did the responses specifically start to centralize to what you view as like an elitist response?
Well, the COVID policies affect people very differently depending on their line of work. And for the people making the policies, most of whom are knowledge workers, are people who were capable, like so many others, of working remotely, given developments in digital technology. It became possible to go home and to interface with people via Zoom and other technologies, to order everything you needed from the grocery store, or to renovate your house or your kitchen on Amazon or whatever, and it would be delivered to you. It became very feasible for people to live in this socially distanced way, for people from a certain place in society, basically well-off white-collar workers and retirees. And so those are the people who could continue to receive an income while staying home, staying safe. And yet there just wasn't an acknowledgement of the extent to which large swaths of the population were not able to do that it was not feasible. I mean, at least a third of the workforce had to keep on working as if there was no pandemic, those essential workers, which is when you began to take a look at all the services that are needed to keep society functioning, you realize just how many people are working in essential jobs. But those people were not policymakers. And so, you had a lot of blind spots in COVID policymaking, and they tended to reflect class bias, where people for whom COVID policy was quite comfortable didn't realize the damage that was being done. You had 30 million people roughly losing their jobs in April of 2020. It took months for those people to receive unemployment insurance in most cases, because state systems were completely overwhelmed with the new applications for unemployment benefits. I mean, the suffering that these people had to go through, and just very little attention to that. It's there were a lot of biases in the COVID response, and they track with the discrepancies between the lives of the people who make the policies and the people who were affected but were not consulted in the policy.
Yeah, something I appreciated about the text is that it took this very complex system, and it did it justice in looking at all the different facets. Because in saying, oh, the COVID policy, in critiquing the performance of a COVID policy, it's easy to respond first off the bat, like, oh, but people were dying. We didn't, is it somebody's job or somebody's life, which is more important? Can you say a little bit more about how the lack of public discourse around the way that decisions were being made in the end weakened the public's trust with things like policy advising and political choices and even the academy in terms of having transparency into how these discussions were being made and just the allowance of the complexity, because sometimes there's not the easy answer.
So COVID policy was emergency policy making. And so it took the form of executive edicts that, governors using their emergency powers would just declare who were essential workers and who weren't, and, what the curfew would be, and how long the stay-at-home order would be. And there wasn't transparency around who was having input into those decisions. At the level of the coronavirus task force that guided decision-making in the Trump administration, that group was made up of generalist government officials, people like Vice President Mike Pence, and infectious disease specialists. And it didn't include a broader range of experts who could offer perspective on what this is doing to early childhood education or education more generally, or what was happening to the millions of people in elder care, or what this was doing to the economy and to small businesses, what this was doing to loneliness and mental health. That those perspectives were not present in the room when these decisions were being made. And in their memoirs afterwards, the major policymakers on the task force acknowledged that they were not conducting any form of cost-benefit analysis. They didn't even see it as a legitimate exercise. I mean, Deborah Birx's view was that if deaths from COVID can be prevented, they should be prevented. It doesn't matter what the costs are. Fauci, said to an interviewer at the New York Times that, I'm not an economist. The CDC is not an economic organization. Those decisions or those issues needed to be brought to bear or raised by others. We were not in a position to do it. Just sort of disavowing any responsibility for considering any costs. I think that was the attitude. They just were not weighing them at all. So that's a recipe for non-rationality in decision making. You have to consider the possible costs as well as the possible benefits, particularly when the benefits themselves are uncertain while the costs are certain. We knew that there would be costs. There wasn't doubt about that. The question is how beneficial these measures would be. The uncertainty and how it was distributed across these aspects of decision making, that was not weighed either.
How did this pay any price affect the way that the pandemic was being polarized? Can we talk more about how the sort of extreme nature of the pandemic was impacting our capacity to make these decisions and participate publicly with the different political activities going on?
Well, if you look at the discourse in the news media, the questions around COVID policy were only framed in terms of how decisions might affect the spread of this one disease. Like there were not questions being pressed about what the trade-offs were, what the costs were. So for people who were feeling the costs, like parents of school children, for example, they couldn't find or hear their concerns being raised in the mainstream discourse. And so that's going to push them away and make them feel they have to turn to other sources. And so you get organizing online, you get the role of social media in the pandemic response, and the development of communities of skeptics who aren't being heard in the mainstream discourse, but are trying to find other like-minded people, using the tools available in our digital society. And so then you start to see contentiousness at school board meetings around masks and other COVID policies those groups were getting organized in digital spaces. There's a lot of social media, very important. And then you see the United States government trying to clamp down on social media, on so-called misinformation on social media. Some of which was misinformation, but some of which was not. Some of which was, the legitimate concerns of people who were not being reflected in policy or in the mainstream discourse that you'd encounter on the national newspapers or cable news.
Yeah. So, in looking at the pandemic and the response to it, we have this federalist outlook. We have all these states who are all going to be making their own decisions, as well as the federal government. And in a look back, you'd say, oh, we have all these different case studies of ways the pandemic was responded to. And taking these case studies, we can make a succinct evaluation of what responses were successful or not successful, and make judgments about how we might be able to do this better in the future. Are we able to make those evaluations within state case studies?
Well, we can gain some information from doing those studies. I mean, none of these policies were implemented in a randomized control trial manner. So that's always going to limit our ability to draw causal inferences from what happened. But we can certainly look across the federal system. What states locked down more quickly? Which ones were slower to impose stay-at-home orders? How long were stay-at-home orders in place? Which states reopened schools more quickly, and which ones stayed closed longer? And so we can collect those data, and we can look and see how states fared in terms of their rates of COVID mortality over the pandemic. And what you see when you do this analysis is that there was a sorting out of red states versus blue states in COVID policy, with Democratic-leaning states more stringent in their COVID restrictions than Republican-leaning states all through the pandemic. So, there was variation in the states' responses, but it's very well characterized by the partisanship of the jurisdiction. And you don't see red states imposing more restrictions than blue states in the midst of COVID waves, that they just stay sorted. So there's not a lot of what in social science you'd refer to as endogeneity in those patterns. And second, what you see is that there was very little difference between red states and blue states in their COVID mortality at the time the vaccines were rolled out at the end of 2020, December 24th, 2020. That's when the vaccine rollout started, and it was by the end of April 2021, vaccines had been made available to all adults in all the states. So what you see is that by the end of the pandemic, our data sets wrap up in 2023. That there was a big difference between Republican states and Democratic states in their COVID mortality at the end. But all of that difference emerges in the post-vaccine period. Red states had a lower uptake of the vaccine than blue states, and that probably accounts, or that we suspect that accounts for the difference. But certainly we can say that the differences in COVID policy over the course of that first year of the pandemic, they don't show up in COVID mortality as it stood at that at the time COVID restrictions were lifted everywhere. I mean, when the vaccine rollout was complete, there were hardly any COVID restrictions left in the U.S. except for things like advisories and communications campaigns from health agencies. But aside from that, all the restrictions were lifted. In fact, restrictions on adult society were largely lifted by fall of 2020. And in many red states, they were lifted in early this summer. So, Memorial Day, lots of states were reopened in 2020. So there had been wide variation in COVID policy for almost a year. And at the end of that, we just don't see a difference that corresponds with what you would have theorized about how COVID restrictions would help. Now, what as social scientists we can say about that is that we can't reject the null of no effect. That's how we'd put it. We don't have evidence that they do work. It's not to say that we have conclusive data that demonstrates that they don't work. That our data are not capable of establishing that. But we don't see clear evidence that they do. But in that second year, you do see a divergence between Republican states and Democratic states in that COVID mortality at the end by early 2023 was 30% higher in Republican states than in Democratic states, but that difference emerges in the post-vaccine period.
If we had evaluations of previous pandemics, we had some plans of how we could respond to crises on large scale. Why were the plans that were initially made before the pandemic, before we knew about COVID, but just as general guidelines, why were they not being followed? And what was the break in our connection to that planned response?
Well, I think the Wuhan example is very important, and that World Health Organization delegation to Wuhan and the report from it that recommends society-wide restrictions on human interaction in order to control disease transmission. Those are very important. There was a important model of COVID transmission released out of Imperial College London. The head researcher was Neil Ferguson. It was someone who had long worked on epidemiological models and projecting high mortality, and based on these models, estimating that mortality could be reduced by restrictions on human behavior. So you have those models in the spring of 2020. Models plus Wuhan. Plus, I think third, the key factor that had been warned about in the pre-pandemic plans, which is that politicians would have enormous incentive to reassure publics that they had control of the situation. And so they take action because the last thing they'd want to be accused of is not doing what they could to protect the people. It's exactly what had been warned about that they would do, that they would take actions that are not proven, that around which evidence was lacking, in order to reassure fearful publics. And so I think if I had to list the key factors that precipitated the response, I'd say those were the ones: the models, the Wuhan example, and democratic publics and elected officials' incentives.
How did the responses by media, by policy advising, and academic institutions, and the general stringency of the responses impact the public's opinion of those institutions or of those areas of influence?
It's hard to nail down cause and effect with certainty in this space, but what we can see has been a decline of trust in media and in academic institutions, and in health agencies, in the wake of the COVID pandemic. So it's most pronounced among Republicans, but you also see big drops among independents. Even among Democrats, it's declined a little bit, not much. So it's politicized, but if we look at attitudes towards health agencies at the start of the pandemic, they were not divided by party. So there's been a polarization around these institutions that didn't previously exist to the degree that it does now. So I think that decline of trust in these in journalism and in academia and in, I'd say, experts writ large, likely grows out of this society-wide experience we had during the COVID pandemic. But of course, you can't easily ascertain the causes of shifts in public opinion. That we see these changes, they are present, they're consistent with the story. But I'm not capable of saying, well, we know for certain what happened inside people's minds. But what we have seen, however, does it bears out the warnings that we saw in the pre-pandemic literature, that you will lose the public's trust. That this was discussed. Like if you take these actions like closing your borders and you tell people that this is going to stop a spread of disease, and then it doesn't do that, that's going to harm their trust in you. They discussed these issues. So this was known, and now what we see is consistent with those expectations.
As far as the policy outcomes as they were being enacted, many of them were quite ambiguous. They didn't have qualitative objectives. How did that affect specifically our capacity to evaluate the legitimacy or the effectiveness of outcomes?
So it really wasn't clear what we were hoping to achieve when these measures were taken. I mean, the initial justification offered was 2 weeks to slow the spread. to give us time to marshal a response. Then, if you read Deborah Birx's memoir, she says, that this was just a public rationale, that from the very beginning, they hoped to keep restrictions in place until the vaccine had been rolled out to the whole population. Even after the vaccine had been rolled out, they weren't prepared to lift all restrictions. There wasn't transparency around what public health experts were thinking there. But 2 weeks to slow the spread was that initial justification. And then it sort of snowballed from there. Then you can't reopen until it's safe to reopen. But then what is safe? The virus, was still there. There was no way to tell the public that they were just as safe as they had been in 2019 when SARS-CoV-2 wasn't spreading in human populations. So by what standard then can you reopen? Can you lift restrictions? It was ambiguous for policymakers. So you get incoherence in the response around a failure to articulate goals. Like, how do you, SARS-CoV-2 is still spreading. It's not going to go away. And of course, early on, there were voices who recognized that given how far it had spread, this would become endemic as other previous pandemic pathogens had become endemic. And so, you do have to ask, like, when was that broadly understood among experts? And then once it is, then you have to realize that containment is no longer a goal. You can't, the political rhetoric that was used around this, you can't crush the virus if it's going to become an endemic part of human societies. Rhetoric was just out of touch with reality. And there was just a refusal to confront hard facts around this crisis.
Tell us what is to be gained by expanding our capacity to sit in these conversations, to experience more of the ambiguity and the complexity of the issues that we're trying to solve for when it comes to really wide, broad-reaching impacts and consequences.
Policy with broad-ranging, society-wide, in fact, ranging consequences should be made with an eye to getting as complete a view as possible. And so when you only talk to people who agree with you, you are opening yourself up to big blind spots. That we all have a preference for looking at data points and arguments that are consonant with our priors, that we want to hear, that are comfortable for us to hear. And so if you allow that to take over, you're just going to miss out on a lot of reality. You need broader consultation. That's one of the reasons why in the book we praise the role of representative assemblies, because they do bring diverse generalist voices to bear on problems that we see they have an important role in policymaking for that reason in particular. But as we engage with these kinds of questions in our lives and in our institutions and universities, we need to be cognizant of the great value of listening to people who don't agree with us, because that's how our blind spots can get exposed.
Well, I just want to thank you for coming on today. For our listeners, if you're excited, if you're interested, if you want to hear more, because there certainly is more, we'll be discussing the rest of the book and its contents with Professor Steve Macedo next week on Madison's Notes. And Professor Lee, thank you so much for coming on today.
Thanks so much, Laura.
Thank you for tuning in on this episode of Madison's Notes from the James Madison Program in American Ideals and Institutions. We will be continuing our discussion with Professor Steve Macedo, who is professor of politics at Princeton University. We will be continuing through the concepts and observations made in the book In COVID's Wake: How Our Politics Failed Us.